Mike Gibson and Cliff Kavinsky come to you live from SCAI 2016 talking about left atrial appendage closure. Cliff, give us a quick summary of the state of the art.
All right, the state of the art concerning left atrial appendage occlusion is that it's for many years been an unmet need. Patients who have atrial fibrillation and who are at risk for stroke, if they could not tolerate long-term anticoagulation, then there was really little that could be done for them. So we have been long seeking a non-pharmacologic solution for patients with atrial fibrillation who are at risk for stroke. And the Watchman device, which was approved by the FDA just months ago, having spanned 2 randomized clinical trials and 3 registries and 3 FDA panel hearings, was finally approved for use. And its FDA approval was based on the fact that for patients who have atrial fibrillation, who are at high risk for stroke, who are eligible to take anticoagulation, and for whom a rationale exists to seek a non-pharmacologic solution. And after the FDA approval, it went to CMS, and there was a national coverage decision, and that national coverage decision basically echoes the FDA labeling, so that now people across the country are able to put these devices in patients who need them. Of course, you know, the important thing is that they be high risk for stroke, and we're defining high risk as patients who have a CHADS-2 score greater than or equal to 2, or a CHADS-VASc score greater than 3. They have to be able to take oral anticoagulation for at least 45 days, and they have to have some rationale for seeking a non-pharmacologic solution to their stroke risk. The Boston Scientific, who is the manufacturer for the Watchman device, has been very careful and deliberate in their rollout of this technology, realizing that it is a delicate procedure and requires extensive training in order to ensure the safe, efficacious rollout of this important technology. And I think as we look over the next year or two, we're going to be seeing more and more of these devices used in patients who are able to take anticoagulation for short-term, but not for long-term. However, there are several patient populations which have not been addressed in the FDA labeling for left atrial appendage occlusion. Subsets of patients who we as cardiologists are very interested in treating. For example, patients who cannot take anticoagulation, oral anticoagulants at all, due to underlying comorbidities or recurrent bleeding complications. These kinds of patients were never studied in randomized clinical trials. And what about the issue of the newer novel oral anticoagulants? These kinds of drugs were never studied in the randomized clinical trials. These drugs were never studied in a comparison to left atrial appendage occlusion. For example, if you had a randomized trial of, say, the Watchman device versus a novel oral anticoagulant, which would be superior? So the Watchman device was non-inferior to patients taking Coumadin, but what about these novel agents?
Sure.
So this is unanswered territory, and I think this begs further clinical trial. But I think for now, the Watchman, the approval of the Watchman is a major advance and meets an important unmet clinical need for many patients with atrial fibrillation who are at risk for stroke. That was a long answer to a short question.
No, that was a great summary. And the future, are there new devices coming along?
There are new devices coming along. There are new generations of the Watchman device, and in Europe there are at least 3 other devices that are basically being tested and have actually received CE mark and are routinely used. So this is just the beginning. I think the Watchman was sort of the pathfinder and will lead the way for other technologies to come along. So this is a very important paradigm-shifting development in the world of interventional medicine. And I think we're going to see good things coming in the world of left atrial appendage occlusion.
Cliff, thanks for stopping by today. Great summary. Thanks for joining us. Good seeing you.
All
Thanks to
right.
all of you for joining us out there live from SCAI 2016.